Eating disorders do not always have something to do with food and weight. Eating disorders are most commonly just signs of bigger issues going on with that person. A lot of times, eating disorders develop because of stress, emotional influences, and depression. Eating disorders are a group of conditions characterized by abnormal eating habits that may involve either insufficient or excessive food intake to the detriment of any individual's physical and emotional health. Binge eating disorder, bulimia nervosa, and anorexia nervosa being the most common specific forms in the United States. Though primarily thought of as affecting females, eating disorders do affect males as well. When will society begin to take eating disorders seriously rather than act like they're no big deal? 1/4 of those with bulimia have had some sort of addiction or alcohol drug abuse in their life. 1 in 10 males develop eating disorders. One with anorexia is really thin, always worried about their weight, and they also show signs of depression. One with bulimia is not happy with the way they look, and they will find a reason to leave after they eat to go to the restroom. One with binge eating disorder will oftentimes eat an extreme amount of food. Although binge eating disorder is the most common of all eating disorders, it's still not considered a psychiatric condition. It is important to be a role model in your children's lives in the development of positive attitudes when it comes to nutrition and what they eat. There is not one particular answer or reason on what causes eating disorders. Eating disorders are complex conditions that arise from a combination of long-standing behavioral, biological, emotional, psychological, and social factors. While eating disorders may begin with preoccupations with food and weight, they are most often about much more than food. For some, dieting, binging, purging may begin as a way to cope with painful emotions and feel in control of one's life, but ultimately these behaviors will damage a person's physical and emotional health. Research shows that there are a few sports that are known to put children at a greater risk of developing an eating disorder, those sports being gymnastics, wrestling, cheerleading, ice skating, and ballet. Research also shows that those with obsessive compulsive disorder and anxiety disorders are extremely prone to eating disorders as well. The media has a lot to do with the rise of eating disorders in this day and age. Oftentimes, the high-powered celebrities are extremely thin and perfect looking, leading young children to believe that it's what every ideal person should look like. There are several types of eating disorders. In anorexia nervosa, many of the health problems are caused by a state of starvation and dehydration, the same thing as those in a loss of muscle mass. The body tries to compensate in part by lower resting and total metabolism and through hormone changes. Changes are often found in hair, skin, slow heart rate, decreased blood pressure, and lower body fat. Bulimics frequently experience muscle cramps, heartburn, fatigue, and abdominal pain. Calluses may also form over the backs of the hands from repeatedly inducing vomiting. Dangerous mental conditions can be caused by eating disorders as well as behavior in health conditions. Eating disorders can be developed as a young child or teen, experiencing sexual abuse, sexual harassment, and even murder. It is very important to try and prevent things you know can develop eating disorders. Learn all you can about anorexia, bulimia, and binge eating. Genuine awareness will help you avoid judgmental and mistaken attitudes about food, weight, body shape, or mobility. Discourage the idea that a particular diet, weight, or body style will automatically lead to happiness, wholeness. Be a model of self-esteem, body image. Recognize that others do pay attention and learn from your weight and talk about yourself. Choose to talk about yourself with respect and appreciation. Value yourself based on your goals, accomplishments, talent, and character, and avoid letting the way you feel about your body weight and shape determine the course of your day. Embrace the natural diversity of human bodies and celebrate your body's unique shape and size. The way you look and feel about yourself as a parent affects your children in either a positive or negative way. As someone who is trying to give advice, it would be better to talk about actual health rather than someone's actual weight. As I stated throughout my presentation, eating disorders do not always have something to do with food and weight. Eating disorders are most commonly just signs of bigger issues going on with that person. A lot of times, eating disorders develop because of stress, emotional influences, and depression. Children learn the most from their parent or just adult figures, period. They are paying very close attention to the way you act, talk, and treat your body. Encourage them to eat healthy. Be supportive of any healthy eating habits that they choose to take. There are several causes of eating disorders, effective eating disorders, and different ways to prevent eating disorders. It could be anything from the size of your friends, the home environment, or even family past, genetically, or the sporting events they may have participated in. The effects of eating disorders are tremendous actually facts regarding eating disorders, and as it says, 42% of first to third grade girls want to be thinner. 81% of 10-year-olds are afraid of being fat. Most kids with eating disorders begin their disordered eating between the ages 11 and 13, and 1 in 10 males are affected by eating disorders. And now it's the question and answer part.
Are eating disorders curable?
Those individuals who get help in the earlier stages of eating disorders can make a full 100% recovery, but that is not guaranteed to happen with every individual. There is always a chance that someone gets help early and after so long develops the eating disorder once again. The individual with the eating disorder needs to make sure they are not in denial and accept the fact that they have a problem and accept treatment with an open mind.
Is there any difference between binge eating and overeating?
The difference between overeating and binge eating is that when an individual overeats, they do not do it every meal, every day, in a inconsistent way. They happen to overeat every so often, and an individual with binge eating will overeat within a certain amount of time. They will consistently continue to do so. A binge eater will consume an enormous amount of food in a short period of time, and they'll often look and feel out of control. Episodes. And that's the end of my presentation.